we recommend that she should start folic acid at least minimum 3 months before she get pregnant, and she should continue at least 3 months after she is pregnant. But this is just little for folic acid. But with the iron consumption, like if the patient is anemic and she wants to have good iron levels, we give combination of folic acid with hemoglobin with iron supplement, so that she gets good chances of raising her hemoglobin, because the folic acid, it helps the cells to multiply, it helps the cells to be healthy, it helps the cell to have healthy inner structures. So the iron also get like better results. The rise in the iron is better in patients taking folic acid. Okay, so now folic acid is recommended in pregnancy. For if you want to know more about folic acid, you have to read this website, NHS Pregnancy, Breastfeeding and Fertility, while taking folic acid. So it is recommended that ideally you take 3 months before you conceive, during the first 12 weeks of pregnancy also. Okay, because it helps your baby's brain and baby's spine to develop normally. You can take folic acid after 12 weeks too. It helps to make blood cells. Your midwife or doctor may recommend you keep taking folic acid throughout your pregnancy to prevent anemia. The best or the recommended dose is 400 micrograms. Your doctor may advise you to take a higher dose, which is up to 5 milligram, if you have a higher chance of having a baby with any neural tube defects, like having a problem with the brain or spine, such as spina bifida. Your chance of having a baby with